crisis. And I mean, and when it comes to human services, as you well know, so we could have there's always a crisis. I mean, now it's, and this isn't demeaning, but now it's the opioid. That's the flavor of the year. Yep. And it was child abuse, and I think child abuse is going to come to the top again real soon. And but there's always a crisis. Always. And certainly the advocates come in and they say you need more money, and Lord knows we never have enough. So I guess I just don't, for me, and maybe somebody can clarify it for me, it just seems like a difference of opinion when it comes to whether somebody should get more money or not get as much money between the county and the vendor, not really an argument over the quality, maybe on the fringes. That seems like I get the sense there's a little tension. I don't know why. There's a little stress for some reason, but at the heart of it, it's about money. And I don't know if we ever had a solution to that. I don't know if we ever will.
Mr. Heckman, if I can...
And that's all I have.
No, that's okay. I have some additional feedback about that. We have been round and round with DDAP, the state, and Recovery Revolution, and as you all know, Human Services have the right to contract with whoever we want to contract with. And the state was trying to make sure that Recovery Revolution understood that we have the sole authority to decide who we contract with and who we don't. Mm-hmm. And if we were being vindictive, we wouldn't have a contract with Recovery Revolution. But that's not the case, as we've been through at length. And if they submit a proposal for this year, for next fiscal year, starting July 1, we will continue to fund.
Let me ask you this, and this is my last question. Do you feel with the funding you have now that you are doing the best you possibly can to ensure that folks in the Slate Belt have the coverage they need for these services?
Absolutely.
Thank you.
You're welcome.
Can I ask you a question?
Sure.
Which extends also beyond this?
Mm-hmm.
Is it our current practice to automatically fund contracts? Because he alluded to the fact that that was a past practice.
No. So drug and alcohol, as I said, when Tiffany started, they started the RFP process. Now that she is in mental health, they have started that process there. And we are slowly working our way through the building to implement that to a degree at least. Aging does not, but I'd like to get there. But at this point with aging, to be honest, it's just a matter of we have so few vendors. It's actually astonishing to me. We're simply at this point of trying to find agencies who can work with our folks. So no, contracts are no longer just doled out, and they're scrutinized for what is funded, because things in the past were funded that were inappropriate for our taxpayers to be paying for, and we don't do that.
Okay. So can we move on to any other topics that you may have? Because I think we talked about it last meeting and this meeting, and we can probably talk about it next meeting too if there's other questions.
Absolutely.
I don't understand why Beth Miller doesn't come up and give her...
Because it's a report from Director of Human Services, so if I have time, I can call her.
Okay.
Did everybody get the Graysdale memo? That might have been longer than last month's memo.
Sue, you know, there was an old saying by former President, or late President Truman, and I always loved it early on in government, and it was, if you can't convince them, confuse them. And I always thought that was a great motto for human services.
I can neither confirm nor deny that, Mr. Heckman.
I'm not making fun of anybody, other than myself.
It's, I assure you, taken me many hours, weeks, and months to understand this entire saga, and I'm ready to put it to rest. So, Graysdale. Let me see. Well, let's do the memo first, because then it'll just be too many papers. Bless you. Did everybody have a chance? Maybe not. The memo was only sent around lunchtime. But did everybody have a chance to take a look at it?
No.
Okay. Well, the
I
other
was
one
driving from Bloomsbury.
The other one was sent last time. At least I got it the day before. But
that's okay.
I did not want to give you an inaccurate memo, and it literally took up until noon to get the final final details confirmed. So I'm not going to obviously read it, but I can go through and give you the highlights. We wanted to make sure that we addressed the concerns from last month's meeting that Mr. Warner raised and some that the nurses raised. So I broke it down into staffing issues, retention issues, and Act 102. The staffing issue is there's a lot of detail, so I would encourage you, obviously, after this to try to digest it. But we touched upon briefly last time that when Dawn Torres-Feldman, who I'm going to just call Dawn because it's easier than the whole last name if people don't mind, when she started, she began tackling the position control. And that's our document that lists all of the positions that are approved by council and budgeted for. And one of the biggest concerns that she found was related to per diem staffing and the percentage of our staff that consisted of per diem staff. So ultimately, there was about 28%, close to 30% of our staff were per diem. At the time, per diem staff were required to work one shift every 6 months. So we had 1/3 of our workforce who only had to work one shift in 6 months. Obviously not the right way to staff a nursing home. So Dawn recognized that quickly. Ultimately, she did all sorts of math and manipulation, and she feels 14 or 15% of per diem, of our complement should be per diem staff. And so we tried to work with both unions. We ultimately reached an agreement with AFSCME that the per diem agreement would go from one shift, a minimum of one shift every 6 months, to a minimum of 4 shifts every month, including one weekend day or shift, one weekend shift, and either Christmas or New Year's Day. So you increase your shifts from 1 in 6 months to 24-ish shifts per month. So there was 84 folks between when Dawn started this initiative and the end of March. 84 per diem staff are no longer with us. So there is this perception. First of all, I guess I should say, we know we need more staff. So that goes without saying. We can talk about that. But the perception when you hear you lost 84 staff, that's alarming. That was 84 shifts worked in 6 months, maybe, and that wasn't always enforced. So we eliminated 84 folks, and ultimately, any per diem folks who were added after that have actually improved the staffing conditions, not worsened it despite the appearance of that number.
And just want to clarify,
Yeah?
so the 84 that left, they left on their will because they didn't want to pick up more to comply with
They were
the...
either terminated or resigned because they were either unable or unwilling to meet those requirements. So, and some of those 84 folks, I don't want to lump all 84, were folks who left they worked at Graysdale part-time or full-time, they left to go somewhere else and wanted to keep their foot in the door, so that if they didn't, for whatever reason, if it didn't work out, they didn't like it, they could come back. And so it's no skin off anybody's back to work one shift in 6 months.
Right.
It shouldn't be.
Yeah, so, okay. So Dawn had a very long-term plan. I think there was about 7 steps. I've outlined some of them. And we have actually completed every step in preparation for hiring the right number of folks in the right nursing division in the right unit. So I think what I told you guys last time is she determined which staff we needed for each unit for each shift, so the number of RNs, LPNs, and aides per shift per unit. She found 169 posting forms signed by John Brown that were either not filled or never posted. So Mr. McClure graciously re-signed those for us. That was a while back. That was a lot of posting forms. We reworked the per diem complement and converted, we talked about this, the 68 part-time float positions to part-time positions, so that people didn't have to float around. They could have a home at Graysdale and be on one particular unit. But essentially, I remember Mr. Warner talking about the hundreds of job postings, and that wasn't a lie. But that's 68 of them. was folks who really already worked at Graysdale for the most part, and were just sliding into part-time slots instead of being floats. And Dawn reallocated about 100 different. She took 100 positions and reallocated them into about 150 positions by just adjusting the FTEs in order to have, the 0.2s, 0.4s, 0.6s, whatever percentage of an FTE she needed for that particular shift or unit. That's how that worked out. So there are still a lot of postings at Graysdale because a lot of them are people having the chance to kind of find a permanent home. There's a ton left from Mr. Brown that we're working on filling. So the initiative with position control is complete, and now it's the hiring part, which we've been doing all along anyway. So, questions so far? Take a pause. Okay. I wanted to give you guys a visual of the numbers. So really, let's just stick with 2018, even though 17 is there. We had 137 folks at Graysdale terminated or resigned, mostly resigned, but that's just how it's written, and 131 new hires. So you think, well, you lost more people than you gained, and that's true. But remember that 58 of those were per diem staff who never worked or rarely worked. So in reality, we actually, even though the numbers are a little bit different, we actually have gained actual shifts that people are working. Call-offs, we've talked about this. That's obviously another area that's, we're working on. In 2018, Graysdale had a total of 13,734 no-pay hours. That means people called out of work and they didn't have any sick time, vacation time, personal time. Now, part-time folks do not get sick time, so if you're sick when you're part-time, you don't have the time. But you're allowed so many occurrences. So if you're part-time, we know you're going to get sick sometimes, or your family's going to get sick. It's if you exceed a certain number of call-offs that you might end up facing discipline. But at any rate, that's such a large number. We compared it with corrections, sheriffs, and 911 center. I think they have about half the staff that we do, and their no-pay hours were 1,833. So it's a lot less than half. And just this year alone, through March, we had over 5,000 hours of no-pay time, and it is on track at that pace to exceed 20,000 hours of no-pay time. It's hard to staff a building. And again, we know people get sick and such, but that's part of the challenge. So interestingly, I think what you heard from one or two of the nursing staff was, and this is in the memo, I'm not going to read it verbatim, but because of what we eliminated with the AFSCME folks was the use of these 99 days, which was you could just call off and you were supposed to have prior approval, and you could take off and not get paid. But there was probably a lack of oversight, and so that got very abused and out of control, to be totally honest. And so in their contract, they agreed to eliminate those. So what you heard was some of the nurses say that people now use IFMLA and FMLA to get around that, to not get in trouble. So again, as Mr. McClure said last time, if someone needs IFMLA or FMLA, we want them to take it. But we have to look at whether that large number suggests the possibility that it's being abused or misused as stated directly by the nurses at council.
Can I ask a question on that? May I please ask a question on that? Okay. So IMFLA and FMLA, don't you have to apply for that for like an extended period of time? So how can you abuse that by just taking a day off here and there and saying, I need an IMFLA day? Like, I didn't think that was a thing.
Oh, it's a thing. It's like anything else, Ms. Zorinsky. You can, first of all, the people.
But it
who
has
need
to be
it is there.
allowed.
Well, it has to be signed by a doctor. Okay. So if you have a doctor that signs it, then you're approved.
I think one of the questions is, she wants to know if there's a minimum amount of days.
Yeah.
that you can have.
No, IFMLA is intermittent family medical leave, so it's.
Can be used to
It-
But
there's
you
a
wouldn't think it
chance
would be
that
just
there
a
are-
day.
There are generally speaking, if I'm not mistaken, although this is an HR territory, there are maximum days, right? You can't just
Right.
take off.
Right.
I mean, if you're off consecutively, that's FMLA. IFMLA, there are a certain number of days. The problem is the number of people at Graysdale who have approved IFMLA. So when you multiply that, it is a very high number. 30% of call-offs in February were FMLA and IFMLA.
Okay, so I guess my question is, if that needs to be approved, even if it's intermittent, it has to be for a chronic reason. Does somebody have like an open ticket to say, you know what, whenever I needed an IMFL, I can take it?
We have some creative ones. If you can find a doctor to sign a note for you, Ms. Zorinsky, you can get IFMLA. It's just the way it is.
I can't, but
Well, then maybe you should call Graysdale.
I know. I'm just thinking that I didn't realize that was the loophole, that I thought
Yep.
you had to have like a family member that was in need that you had to take care
You could suffer
of.
from migraines, maybe. You could suffer from anything that sort of gives you liberty to take off as needed.
Like IBS or like something
Yeah.
like that. And
Yep.
you, like how do you, yeah,
Right.
okay, I got you.
Okay.
Okay.
Yeah, go ahead.
And just hypothetically, without addressing any specific aspect of real folks, I think the problem you're having is, well, you don't get paid,
Yeah,
right? And you're thinking to yourself, well, I need to get paid. You don't work in an environment where overtime is readily available, so that
Oh, so you could take
that
an IMFLA
or
day.
that you get paid even more for working a second or third shift, or get paid
Okay.
more for working on the
so
weekends.
you could take off a day at regular pay and say, you know what, I'm just gonna work an overtime day now and get paid twice as much.
Ding, ding, ding,
It's
ding,
not
ding,
as
ding.
straightforward as that, but you have the general idea.
Wow, that's, okay.
I've learned a lot of new things in this job.
I don't have a job with
Okay.
a workaround like that, but
Can
you
we-
know,
Move on? Yes,
Yes.
ma'am. Okay.
it's interesting.
PPD we've talked about in terms of staffing, because one of the nurses mentioned that somebody asked if staffing is, how long there's been a staffing problem. I think it was you, Mr. McGee. And the answer was years, although it's gotten even worse, and this past year it's the worst it's ever been. And that's just, I respect that it feels that way to the folks there, but the data does not indicate that. PPD in February of 2018 was 3.06, and it was 3.41 in February of this year. And I know we heard some of the nursing staff talk about that and what that means, but regardless of what it means in...
Could you just wait a minute, because
Yeah.
I'm hearing three
Sure.
conversations and not yours.
Yep.
Thank you. Go ahead.
Regardless of what that means in terms of how it was discussed in council, what it indicates is that there are more staff working this past February than the February before. Resident falls. I was really concerned when I heard one of the nurses talk about a resident who was on the floor for a half hour. Dawn investigated that, and there was one particular fall that the resident was not on the ground for 30 minutes, but it was longer than it would normally be, because the supervisor, the supervisors, they mentioned this last month, have to assess safety and physical, do a physical assessment before the resident can be moved. So that did happen on one occasion, and they are working on ways to ensure that does not happen again, but we have no other complaints or reports about that happening any other times. So obviously, hopefully that was a very isolated incident. And Ms. Colon expressed her, concern with staffing, but her great appreciation for administration and Dawn and everything they're trying to do. Any questions about staffing? The rest will be easier, maybe.
No, I just wanted to make a comment that I went down to Graysdale and I toured every single floor.
Hope you wear your sneakers.
No, I did have like an inch and a half heel on,
Bad
and I want to
move.
tell you, we took a lot of stairs because one of the elevators was out, and
Yeah.
but that's fine. I needed the exercise. The point of the matter was I really have a great deal of compassion for these nurses that show up
Absolutely.
for work
Yep.
because it is a depressing environment. I mean, to go in there as a person who doesn't work in that industry or in that field, I mean, it was troubling. Not because the conditions were poor, but just because of the amount of, like, suffering you see. Do you know what I mean? It feels...
Yeah.
And so when I hear that people are taking off from work, or they're ill, or they have migraines, or this, it's hard for me to say that it's not justified, or they can't do it, or I understand that it is a workaround and it's very creative. There has to be a way that we can work this to make the conditions better for them so that they want to come to work, and so that even in the midst of experiencing what they experience every day, they can feel proud of the work that they do, and they also can feel that they're healthy. You know what I mean? Because I imagine being around that every day, that you do pick up a little bit of, like a heaviness.
Sure. Listen, it takes a special person to work with the elderly and in a nursing home. This is not an assisted living facility. This is where very sick and very old people are going, and they're not leaving.
No.
This
is the last stop.
This is not a party. And the staff there do an amazing job trying to maximize quality of life for all of the residents. There's no doubt about that. I give them all the credit in the world. I'm just giving you the facts too, but
right.
You're spot on. It takes a special kind of person to be able to work there. It takes a special kind of person to be able to work at children and youth and go into traumatizing situations on a daily basis where children are being abused and neglected, sexually abused, physically abused, near fatalities. It takes a special kind of person to do that work.
That's without a doubt. And when
Yeah.
I talked to both Jen and Dawn, I really felt like they were trying hard to bring up morale and to also bring some creative solutions themselves to the
Yeah.
problems of working at Graysdale.
I think most importantly, when we get to the retention piece, it's the employees. We need the employees. We need to know what will help them, other than more money. We know more money. That's obviously what you heard. But
You could throw money at a
I can't-
problem, but it's not going to make the situation better.
That's correct. And there are things we
Yeah.
can do, and we're
It's not about money.
Because
I
you
believe
think the money is going to make it better, but it doesn't necessarily make it better because you still have to go to the same job.
That's
It's
correct.
improving the
Correct.
environment.
Mr. Lott had a...
Thank you. Just a couple quick things. I worked in Graysdale as an outside contractor probably 2 decades ago. I went to a tour the other day. I was pleasantly surprised on the cleanliness and how well 20 years ago, I still remember the smell in that place
Yes.
and thought, I never want to end up here.
Yep.
I didn't have that feeling. It's a very
Good.
difficult place to be. My father-in-law is in a nursing home, a private one. We pay about $5,000 to $6,000. That nursing home is cleaner than the nursing home
Yes.
he is in.
Yes.
That being said, I know we're on staffing. A couple of things. What I heard from all the workers was not so much the money, but the workload that's on them. So I truly believe we have a staffing problem.
Yes.
But it's a very difficult problem because we're competing with private people that give all kind of sign-on bonuses. I know some
Sure.
nurses sign in, and I don't quite honestly know how we can overcome that. But I learned something, and I just want to make sure I'm correct on this. When we hire, say a nurse is working for Lehigh Valley Hospital for 15 years, well-qualified nurse, or any place out there, we hire them. We make them start at the bottom. How can we ever recruit anyone of quality if we make them start at the bottom? I realize this is negotiation, and I realize it's a union thing,
No,
but I don't do that in my union. If the guy's qualified, he gets paid for what he's qualified to do.
I believe
Just a
it's
statement, that's all. Thank you.
I believe that's a home rule charter issue in terms of coming in at the first step and having authority to approve up to, not home rule charter. Well, there's a policy. There's a policy somewhere. I did not make it.
Contract.
Oh, it's a contract.
It's a
I just
contract.
want to take a minute here and assess the
Thank you.
time. We need to end at what time? 5 of?
5.
You need 5-minute break?
Next one starts at 5.
I just want to make sure we have enough time for you to do what you need to do.
I do not have much of an agenda other than Graysdale, so.
Okay.
Can I ask a question?
Sure, I just acknowledged the time, so go ahead.
That's right. No, that's all. Mr. Lott, I can reference that too. My mother-in-law was at Graysdale, and my own mother was at a private home, and they both passed on since then. Honestly, I thought that the care that my mother-in-law got was every bit as good as the care that my mother-in-law got, so I never had a problem with that. And I know when my wife had to make a choice, because she was at assisted living, but she was in a situation where you could go into the specific nursing home, but they made it clear from day one that when you run out of money, you're out the door. They wouldn't take Medicaid. So I said, well, don't go by me. You should research. And she did do what Mr. Lott referenced, and that was, I said, do the smell test.
Absolutely.
Go in, go to the lobby, walk around, and smell. And she said, I won't mention the names, but a couple of highly rated, and that's why you got to be careful with ratings. We're not that good.
Yep.
Graysdale was very good, and I think that I don't know the solution either. And I know the administration is working with the bargaining unit. I think, though, it's very. If I'm not mistaken, though, we're competing probably with other nursing homes. I mean, I think the hospitals are the culprit, because they'll come in and poach from everybody because they can pay so much more.
Yeah, and I think
These healthcare
we're-
systems are rolling in dough.
And the important thing is to be comparable with,
Yeah.
similar places. But we have to remember and I think the nurses said it themselves, there's a nursing shortage.
Yes.
So there's a shortage, and we're competing
So
for
I know
staff.
we talked about it, and I don't want to belabor, Madam Chairman. Is the problem more focused to the RNs? I wasn't clear on this. Or the CN? I know we have a shortage across the board.
I will tell you, it's harder to find
RNs.
and hire RNs than it is LPNs and CNAs, yes.
Because it comes to pay. And
there's
we
fewer.
can, at our discretion, bring RNs in at whatever step. You would have to come and get our approval if you wanted to. The contract is clear, you cannot bring them in?
Yep.
Oh, okay. Okay, yes, I'm confusing careers.
Supervisor, but not a,
You're right. The other statement is, people go on about overtime. And I know there are folks, especially in the prison and Graysdale, who can do quite well with overtime.
yes.
And that's okay. And overtime actually can help, because when you factor in about what you have to pay somebody, a brand new person with legacy costs. But I know at times it's been shown that some folks overestimate their ability, and then they get
Burned out.
They get a little maybe sloppy. They get a little tired.
Sure.
Which you've talked about how difficult.
Oh, they said
I
that
could not
themselves,
work
yeah.
in a nursing home. I don't know many people. It takes a special person to do that.
Agreed.
And I don't think I'm that special. So the thing is, I know I'm not. So I'm not. I did casework, but I couldn't do that. And the thing is, I just think that we also then have to monitor, and it's not like, well, I'm willing to work all these overtimes, but I'm sure the staff has to say, the administrative staff says, you know what, I can't let you work X amount of hours, because it's just not going to, it's a safety issue for
Yep.
both the employee and the residents. So, I mean, I agree with Mr. Lott. I agree with everybody here. I don't know what the answer is. I hope it is worked out, but thank you.
May I just reflect on one thing these gentlemen have said?
Sure.
Just very quickly. We spend a lot of time talking about the professionals, the RNs, the LPNs, and the CNAs, and rightfully so. What great work they do, and we really have to respect the dignity of that work. But there are other people whose work at Graysdale we have to respect the dignity of. And I think Mr. Lott and Mr. Heckman both hit the nail on the head here. When you walk into the place, you talk about the smell or the lack of one. How about a shout out to housekeeping? What a terrific job they're doing, right? And if you walk around, now our physical plant's getting a little dated. I think you've probably heard a little bit about, and you're going to hear more from Mr. Amelia and Graysdale administration as we go forward about stuff we're going to do to update the building, make it look a little better. How about a shout out for maintenance? What a terrific terrific job the Graysdale O&M guys do. Everywhere you go, talk about Graysdale food. The food at Graysdale is good. The employees like the food there. The residents like the food there. How about dietary? I mean, these people are just as important as the folks who are providing the the physical resident care. And I think that they do a great job. And with all of our emphasis on the nursing aspect of it, we sometimes forget all of those other people out there who are as integral to the care and the quality of life of the folks who live there. So I just wanted to, while you guys were around the edges of that, I wanted to sort of bring it in focus. Thanks, so I'm sorry.
Yeah, no problem. Okay, CNA training program. I promise the rest is actually much quicker. Well, I think. Mr. Warner asked about paying individuals, which I think I mentioned was one of our early ideas. Apparently they actually did that in the past, and that practice was stopped for 2 reasons. One, once we paid people, they were treated as employees, and even if we didn't want to hire them at Graysdale because it was not the right fit, we still had to go through the same kind of disciplinary and termination process. And the other reason was most people were attending because it was the only program that was paying folks. That said, it's a good idea. Whether or not it can ever be done is a separate issue. Mentoring program, that has been a topic of conversation, I am told, at Graysdale for years. This administration, myself and Mr. McClure and the folks at Graysdale are committed to getting that done. That said, we need staffing at optimal levels to be able to do that, and we need to meet with the unions and get buy-in from them to really make sure that that's an effective strategy. But it goes without saying to me, I mean, that's just a no-brainer. So we will get there somehow. Mr. McClure addressed the 12-hour shifts last time. Morale and retention. I'm not going to go through everything because that's at least, I think, more self-explanatory. I will say with the new electronic health record that will be coming at some point, hopefully on the Finance Committee this month. We had an agency nurse at Graysdale for the first time within the last couple weeks, and when she walked out the door, or probably when she was there for 10 minutes, said, "I am never coming back here until you replace Cantata. I am not using this electronic health record system again. When you get point-click care, I'll be back." So Jen talks about that, but that's a real-life example of how frustrating it is for folks who are used to a much easier and more efficient system. Mm-hmm. The other thing that we're hoping to do in the near future, we're exploring the cost now. There's a different kind of MedPass system that ultimately will reduce time significantly in passing meds to residents, which is a huge issue. Ensure even greater accuracy, although we don't have many med errors, knock on wood. And most importantly, perhaps, is allowing staff even more time with residents. So more to come on that at some point. And I know it was commented, I'm not even, never mind, Mr. Lott sort of touched on that. So staffing alerts, someone complained about expressed concern with the number of staffing alerts they get saying they need staff. Just as an FYI, those settings can be changed to anybody's personal preference, so you never get notified, or you get notified once a day. But if you don't change it, apparently you get notified every time we put out a request, which can be annoying. I agree. So anyway, mandating. We sought an opinion from the solicitor's office, and we got that back yesterday, I believe. And ultimately, the solicitor's office said that our policy on mandating does not violate Act 102, and in fact offers a greater level of protection than Act 102 by allowing one refusal per quarter without being disciplined. But just to give you guys an idea of how often that's occurring, from January 1st to March 31st, we had 12 instances of mandating, either due to snowstorms, there were 2 or 3, or call-offs, the largest one. During those 12 instances, we had 283 employees call off, and only 16 staff were mandated, because that was what was needed to meet the minimum staffing requirements. So it's important to know that. And I gave an example because they talk about the holes in the schedule. You can't mandate for holes in the schedule, which we wholeheartedly agree. You can't. It's clearly not allowed. The nursing staff asked for scheduling to come out 30 days in advance. I think it used to be 2 weeks in advance. So when we put a schedule out 30 days in advance, there are holes in the schedule 30 days out. And what happens is there are volunteers who want the extra overtime, or folks who work part-time and only have to work 2 shifts per week that volunteer to work more than 2 shifts per week. So they just let the office know and they're put on the schedule, and those holes get filled. So if, for example, we have staffed on one unit, let's just stick with one unit for an example. Say we need, say we have 10 folks staffed, but we only need 7 as the minimum staffing. What the example notes is if 3 people call off from that unit, we're not going to mandate anybody, even though 3 people called off, because we had more staff than was necessary. Now, we all want more staff, I get that, but requirement-wise, if 5 people called off, we'll mandate 2. So we're not mandating at a 1-to-1 ratio. And what's really important to note is that there are increasing occasions when shifts are in fact overstaffed, and Graysdale is having to cancel agency nurses because our own folks want extra shifts or the overtime, and they get priority over agency nursing. So obviously the goal is to rely less on agency nursing as well. We are, however, I will say this, we met with both unions in the fall to try to streamline this mandating process. Ms. Kelly and a bunch of us, mostly Ms. Kelly, tried to figure out how can we make this a voluntary system. So we presented the idea to the unions about we'll put up the schedule with the holes, and everybody pick one shift sign up for voluntarily. And if people do that, there'll be no holes. And if something happens, if there's a weather incident or there's too many call-offs, if you volunteered even just 1 shift a month, you don't get mandated. So we thought really close to getting that agreement, and it did not happen. Now AFSCME has come back to the table and suggested essentially the same proposal. So we're sort of hoping to close that deal soon, because it will help us, it will help them, it will help the residents. So if we can get a voluntary system where folks pick up 1 extra shift a month, they won't be mandated. So we have to streamline the process of, with the seniority list and who gets called and how that works and tracking it. But we're waiting for the unions to get that done. So, any questions about that?
I have a question about the electronic records,
Sure.
because we did start to talk about that in January. So what's the process, or where are we in the process of implementation?
I'm told that Mr. Barron was putting the point-click care folks on the agenda for the Finance Committee meeting this month. I don't know when that is, but I'm hoping that's accurate. And so if that happens and if Council approves that, they will be ready to get started the next day. I think it's a 3 to 4 month implementation process. I believe Dawn got a promise out of Jen Stewart King to have that implemented by sometime in August. So that's the plan. And
Does that include full training in
Yes.
the staff?
Yep.
So it would be fully online by August.
The goal is I think it's mid-August. But if
Mid-August.
not, it's the end of August. So the sooner we get them through finance, and obviously we can get going on that.
Okay. I guess. Is there anything else? Well, in general, do you have anything else? Because
I only really have one other thing, given the
Okay.
time.
No, you
Okay.
go first.
Well, it's an introduction of somebody, so maybe your questions first would be better.
I have a question, if I may.
I mean, if that's okay with Ms.
That's
Seffer.
okay with, yeah.
Mr. McGee, go first, since he
sorry.
hasn't asked a question all day.
Well, I'm not on the committee. I guess my question is, back on the opioid thing.
Yep.
Back at, the Slate Belt area. You don't have to answer this question now, but maybe you can get it to me or
Sure.
look into it.
Sure.
So there was some, in the room, there was this thought that, did anybody ever get turned away treatment?
Mm-hmm.
Okay, so that's my question. Okay, and you don't have to answer it now.
No, the answer is no. I mean, ultimately, folks who were new that went to Recovery Revolution that we were told about were referred elsewhere and went to treatment. It was a few to a handful. I'm not saying that number hasn't changed in the last 2 weeks.
Okay.
And again,
And that's just from, January.
That's not
to-
even from January. I think that was, well, maybe, but I think it was more February or March.
Okay.
Yeah.
All right. Okay. And then my other question, and this is my last, I just want to comment. I also toured Graysdale.
Yes, I heard.
Because of the last meeting, I've been trying to get it on the calendar, finally did it
Good.
on Tuesday.
Good.
Ms. Stewart King did a great job, took us around, and I was very impressed with it, because I have to tell you, and it's the same comment that Kevin made. 6 months ago, when our apprenticeship teacher was in memory care, and I'm not going to name the facility, but it was a private facility, and I haven't been at those facilities since my grandmother was in. It was a while ago.
Sure.
My mom was in the hospital. But anyway, I was surprised at the cleanliness and the organizational, like in the hallways.
Yep.
It's clean. I was very impressed with that. I really was. And only comparing it to one other
one
private.
place, yeah.
Only one other private place. That was okay. That's all I have. Just that comment.
But to reflect back on Mr. McGee, we would never deny someone treatment. If the only place they could go was Recovery Revolution, that's not even a question. There's nobody who's not going to be treated in Northampton County for drug and alcohol addiction,
But that
whether
doesn't-
it's there or
right.
somewhere else. Absolutely.
I know there's still a transportation issue up there, and
If someone had no transportation and the transportation to Pyramid did not work, we would make it work at Recovery Revolution. We're not going to have somebody not getting treatment.
thank you,
Sure.
thank you, Madam Chair.
Okay, but she has one more thing.
It's a
Oh,
short,
she has
it's
one
a
more
short
thing.
thing. It's a short
She wants to
thing.
introduce somebody.
Yes.
Yeah. Oh, okay.
I know that the state is doing a great deal of work following up on the Grace Packer
Yes.
incident. And I've been following, and I've been going on, I've been reading the papers. As a former child abuse investigator myself, it's been very troubling to me, this whole episode. Are you getting, I understand they're going to put reports out, and they may look at different mandates. Have you been contacted, or Mr. Dolan, as to anything the state is possibly looking into in terms of their operations or regulations they may impose, or new regulations?
We got a copy of the death report, redacted copy of it, which is the same that I think any of you can find online.
Mm-hmm.
We're not privy to the full version of it. So there are recommendations in there. I have not had a chance to. It's a very lengthy document. I didn't have a chance to read all of them yet, but we've discussed them. My guess is that we are willing to have any recommendations the state will give us. I do know that one of them specifically is give funding with your new recommendations. That came out of the death report. You can't give 20 new laws. Well, it was way more than that, but and new guidelines and no funding, which is what happened. So.
Yeah, I mean, I was just curious, and I know at different meetings, and Graysdale does take a lot, as it's a big operation. It will. If at possibly, and I'm sure at different meetings, we can spotlight specific divisions, because I know we run into the clock, and I know you give an overview,
Well,
but I know for
right.
like children and youth,
Sure.
it would be good to focus on children and youth one time.
Yeah.
I'm sure there'd be a lot of questions that would come up, I just, because this is a situation, and I do know somebody I talked to at the state said that they'd be looking at the possibility of staff being allowed to foster, they get into adoption, but they particularly want to look, and this isn't saying anything about any specific staff. We had an incident that was horrible. It's not an indication of the whole, but that it does present a problem because it's someone who understands how to game the system.
Sure.
And that something I had never thought about, because it's been brought up lately, that this is a field where predators, well-educated predators,
Sure.
could be possibly looking into. and we tend not to look at our own as opposed to looking outward. So I just wondered, and I didn't know if you had received anything yet.
Well, I come from KidSpace, as you know, Mr. Heckman, and we look internally. So I have that perspective
Oh, yeah.
already. So so we do look internally. But I will say one of the recommendations, and then I'll do my introduction if that's okay, is increased communication that's allowed between counties and the state and counties during investigations. The law prohibited Lehigh County specifically, because that's who it was at the time, and the state from informing us of any investigations that were ongoing with that employee. And frankly, if there was an employee now, we wouldn't know. It's a crazy system. It's a crazy system. So that's one of the recommendations, and we would certainly support that.
So we have about 2 minutes, and I have 2 announcements, so go ahead.
Okay. I have one thing left.
Go ahead.
And I was going to do it at the beginning. I forgot. Sorry, Robin. I have my the current Health Choices Administrator / she's really the Deputy Director of Human Services, Robin Barbosa, here to meet everybody tonight. As soon as she replaces herself, she'll really get to be the deputy. So I just wanted her to have a minute to say hello.
Hi, Robin.
There she is.
We'll have you back to talk sometime. Get ready for all these kind of questions, okay? I had 2 announcements. I can't remember the one. I know that May, I know what it was. May, I cannot have the meeting on the 3rd week again, so I'd like to move it to the 1st week again, if that's possible, same time, 3:30. I forget what the date is, if it's the 3rd or the 1st. I don't remember. If you're not here, Robin could give you a report. And I just wanted to talk to Brian, to talk to Jen about the fact that because our original report on Graysdale
Yes.
is a little skewed, that maybe in May we could have the March, and I don't know if you'll be ready for the April.
We're happy to send you what you would normally have gotten in 2 weeks.
Mm-hmm.
We're happy to send that to you via email. That I know you hate the word dashboard, somebody does, but we're happy to at least send you that report then, so you don't have to wait for it. And if anybody has any questions and they want to email them to us, we're happy to do that.
It is May 2nd. May 2nd.
Is this going to be an ongoing thing that you want to
I'm
just
not
change the
sure,
meeting?
but I absolutely can't be here for those meetings, so I like to chair
I'm
my
just
own
asking
meeting.
because,
It might be, if it works out. Not on there. It's making fun of my religion. That's not nice. I'm with you. I'm going to adjourn the meeting. Thank you for your time.
Thank you.
This was good. This was nice to lay all this out.
Let me know if you have questions after you. It's a lot.
And I know you know this, but I think once we get the staffing up,